should also keep a note. When the patient, and I gave the patient, it was 19, I did not give the valve. This was the thing. Patient came back, I made it 18. So you need to follow that up. So definitely there will be some kind of a jaw ache, some muscle pain, some xerostomia and all of that. And all of these are mostly transient. Okay? So I'm using it despite with the TMD because for me, I'm monitoring this thing very carefully. And if the patient has very severe TMD, again, then you need to be a little careful, then you need to evaluate, and it's better not to go for it, but mild TMDs, I think it's perfectly okay. And always tell the patient now, even when you're this thing, so what is important? Okay? The patient needs to get better or needs to sleep better. So only if they understand the importance of all of that, they will understand whatever you're trying to say. So there are certain exercises that you can do, okay? Basically breathing exercises that a lot of exercises that are available on YouTube, but apart from that there's something called a tongue pop. And trace the tip of the tongue to the back of the palate, okay? And these are exaggerated movements, E, oo, basically to activate your muscles, to improve your muscle tonicity. So yeah, the rest of everything, whatever the salivation, all of these things settle down after some time. A lot of case studies are there. Okay, so like as I told you, this has come from a sleep physician. So, and there's a lot of research behind this. So it's a very promising thing. The main thing, in a quick this thing I will just explain. Patient comes, you evaluate the patient or your normal patient, ask them for symptoms, do the examination, do the Mallampati, check their existing baseline this thing, use the bite fork, take the double-sided, but before, most importantly, financial consultation. I just mentioned that also. Yeah, first is the money, no, then only then they will take the bite and this and that. Yeah. So this presently costs 14,750, I think without GST. The VAT is 3,000. The bite forks come around 300 or something. The gauge, if required, the gauge can be used as many as you want. It's 3,000 something. So initially, I think the double-sided bite fork is more than enough. What I charge, okay. Now, we've been doing a lot of social media this thing for this. I personally charge, I know you may be like, what? I only charge 35,000, okay? So the cost comes out around 20,000, everything to 20,000, like 20,000 only the first time, otherwise it will be around 17 or 18, I guess. But I only charge 35 because for me it is, I don't consider this as my main revenue stream. Okay, so please don't charge 3 times and all of that. And then, first of all, no patient is going to do it. They will do it. I know a dentist. I know a dentist who has charged 80,000 for this. And if God has blessed you with that, it's not possible for me to convince a patient for 80,000. But definitely, depends on the practice.
The bands, how much do they cost? We said you need to
Yeah, the supply costs around $1,000 or something.
So every time you get only the entire set.
You get the entire set after titration. You get to an entire set for a year.
No, in the sense you'll have 30 to 21 in every set.
No.
I can choose the size.
Yeah. So 18, if 18 is selected, you get 25 bands of 18. So the patient can use for a year. Okay. And for the resupply and all, I don't charge. I just charge whatever it is. So if you have a high flying practice, it is fine. You can definitely charge. We have an empanelment scheme now for those of you who have attended this and understand this. So, patients can be directed to that. I can contact the sales team for that. The main reason we thought of that is we did a lot of awareness thing for this among patients. Patients go to the clinics and the dentist charge at another rate, and then patient doesn't get anything done. So which is why we try to get more patients to use it, So that's why we have that, this thing, you can contact our sales team for that. So, and after that, follow-up is important, monitoring is important. Don't give false promises, right? Unless you do a sleep study and all of that. OSA is not a simple condition. So, and trust me, they will be very grateful. Okay, it is not like, not just your smile design and all of that. Because if you sleep better, you feel, yeah, your life changes. Trust me. So, they'll be very grateful. And whether or not after this you're doing cases or not, please look for this problem and advise patients for this. Once they know this, once they do something, they will be grateful to you, right? Till now, what is this thing? The myth was, if you're snoring, you sleep very sound. Super, you're sleeping so well, you're blessed with good sleep. Trust me, my colleagues at Dencare only used to tell me, yeah, Dr. George can sleep anywhere. Amazing. So that was the case. So, and my ignorance is this thing. So I've told you, I think within this limited time, whatever maximum possible, and I don't think I kind of left out anything. Usually courses for this are pretty expensive, to be very honest. If you want to do some course on sleep, maybe they'll go a little more of details, but that costs around 2 lakhs, 3 lakhs, and things like that. So I've tried to give you what all I know in a capsule form, and I'm sure if you give awareness, patients will thank you for it. Pediatric OSA, please do not ignore. You have myofunctional therapy and all of that, and you can also get the adenoids rectified by an ENT specialist. So please do this, and it will be a life changer. And they will not leave you for dental. They will never forget you. Okay. So thank you so much for this opportunity. This is our website, Treatment for OSA.